Hello, I'm Dr. Jason Sutherland, a family doctor in Sudbury. As a physician, I have an interest in the health of all Northerners, and I'm committed to reducing the impacts and number of cancer-related deaths through our cancer screening programs. Too often, patients put off cancer screening. We hear patients say, "I feel well. Why should I worry about cancer screening?" Today, my message to you is simple. It's time. It's time to put your health first and to say yes to cancer screening. Cancer screening is testing done on people who may be at risk of getting cancer, but who have no symptoms and generally feel well. Screening can help us find cancers when they are small, less likely to have spread, and more likely to be treated successfully. Let's take a closer look at breast cancer and the importance of screening. According to the Ontario Breast Screening Program, we know that breast cancer is the most commonly diagnosed cancer in Ontario women. In fact, 1 in 8 will get this cancer in their lifetime. Fortunately, breast cancer has one of the highest survival rates of all cancer types in Ontario. People ages 50 to 74 have a lower risk of dying from breast cancer when they are screened regularly with mammograms and cancers are found early. The Ontario Breast Screening Program recognizes the importance of screening recommendations for transgender and non-binary people, and they have developed eligibility criteria based on the best evidence available. The program is expanding its services to meet the needs of transgender and non-binary people. Ask your doctor or nurse practitioner about the timing of these changes and if you should be screened before then. The best way to find breast cancer early is with a mammogram, which is an X-ray picture of the breast. Many studies have shown that regular mammograms reduce the risk of dying from breast cancer. You should know that screening tests are not perfect. Mammograms may miss some cancers, and some may develop in between screens. To be of most benefit, mammograms should be done regularly to help improve your chances of catching a breast cancer early when it can be treated more successfully. Your age and family history help determine when to get screened. In Ontario, breast cancer usually develops later in life, with over 8 in 10 cases diagnosed in people over the age of 50. Family history is important, but remember that most people diagnosed with breast cancer do not have a family history of the disease. Screening is recommended every 2 years with a mammogram for people aged 50 to 74. Self-referral for screening can be made at age 50, which means you don't need testing to be ordered by a healthcare provider. Some people may be at high risk for breast cancer. However, less than 1% of people face this risk. The Ontario Breast Screening Program recommends that people as young as 30 who are confirmed to be at high risk for breast cancer get screened yearly with a mammogram and a breast MRI. A referral by a doctor or a nurse practitioner is needed to confirm someone's eligibility. During a screening mammogram, 2 X-ray pictures are taken of each breast. The technologist who takes the X-rays is trained to ensure that the test is as comfortable as possible. You can expect to feel gentle pressure, but it should not cause pain and does not harm the breast. Afterward, the mammogram is looked at for any changes by a doctor who specializes in breast imaging. For most people, mammogram results will be normal. In the case of any changes or an abnormal mammogram, further tests would be necessary. For every 200 people screened in the Ontario Breast Screening Program, about 18 are referred for further tests, and only 1 will have breast cancer. Don't forget, there are ways to reduce your risk of breast cancer. People who limit alcohol have a lower risk of breast cancer. This is also true if you maintain a healthy weight and keep active. Smoking is linked to many types of cancer. There are no safe tobacco products and no safe amount of smoking. Quitting can be hard, but it is possible, and you are more likely to quit if you get help. It's time. Book an appointment with your doctor or nurse practitioner to discuss the right screening at the right time. For more information, go to www.hsnsudbury.ca/cancer screening. Please consider sharing this video with your friends and family. They too may benefit to hear that it's time for cancer screening.